Hi, my name is Jennifer Mikenas. I am a program manager here at Mama's Voices in our training department. One of the most common questions that we hear during our lived experience integration training is how do we get buy-in from leadership within our organization? So today I am going to walk you through a few strategies for approaching your organization's C-suite to secure their support for lived experience integration and meaningful patient engagement in your quality improvement work. We know that having executive level support can really make or break your efforts. And when leadership is on board, it opens doors to creating a patient engagement program that is both valued, but most importantly, sustainable. But getting that buy-in is going to take a little bit of planning on your part. So here are some ways you can approach it. First, understand what matters most to them. Before making your case, take the time to learn about your organization's current goals. What challenges is the hospital or health system facing? What metrics are they watching? Things like patient satisfaction, care quality, cost savings. The more you can connect bringing in lived experience to the priorities that your leadership already cares about, the more effective your pitch will be. Look for a champion inside your organization who already understands the value of patient engagement. Maybe it's a department leader, a clinician, maybe it's somebody in quality improvement. Having someone who can already vouch for this work, especially a respected peer, can make a huge impact on how it's received at the leadership level. Make sure you bring data. We know this work is powerful and we have seen it make a difference. But when you are speaking to leadership, it really helps to show that impact in numbers. Share case studies. Share industry benchmarks like patient satisfaction, or show data points on metrics like reduced readmission rates, operational efficiencies. If you are not yet collecting data about the impact of including patients in quality improvement work, now is the time to start. And don't forget to bring up the financial impact. Patient engagement doesn't just improve care, it can also improve patient retention, it can reduce gaps in care, and it can build trust. And when patient feedback is informing policy and procedure changes, the outcomes are more practical and sustainable, both for providers to implement and also for patients to navigate, which can have a huge impact on their adherence to their treatment plans, which we know affects your bottom line. Make sure you get leadership involved early and keep them involved. Don't wait until you've built out your whole plan to bring them in. Invite them into the process. Ask for their input. Provide updates to them regularly and show how you are aligning with the broader organizational goals. That ongoing engagement will build ownership on their part. Another really important tool, patient stories. Sometimes a story is what makes it all click. Sharing real experiences from patients or families who have felt the transformation that positive patient-provider engagement can bring to an organization, that's the type of story that can shift perspectives in ways that numbers alone never could. And then finally, be transparent about challenges or risks. There may be upfront costs or training needs for your staff. That's okay. The key is to identify them and then share your plan to address them. It shows leadership that you are thinking long-term and that this work is both thoughtful and realistic to implement. At the end of the day, leaders want to improve outcomes. They want to reduce risk. They want to serve their communities well. Partnering with patients and families can support all of those goals. And when you speak to that directly, leadership is more likely to get on board. Thank you for watching, and thank you for being a champion for bringing the patient voice to your work.